Hi, welcome back. My name is Dr. Mary Ann Shepard, and this is the second video in our series on punishment. So today we are talking about what to do when my child tantrums. I think this is probably the most common question I get asked all the time is, what do I do when the behavior happens? How do I respond? What's the best way to respond? And my answer is always, it's not that simple. So we want to have this magic quick bullet response that says every time that this happens, this is what you do and the behavior goes away. But it's really not that simple. So I'm sorry to break that to you, but it doesn't mean that there's not an answer. However, the answer has been in a lot of our previous series. So what do you do when your child is having a tantrum or when the behavior occurs, when they're having this meltdown? The quick answer is crisis management. You don't give in to their demands. So if they're having a tantrum because they want a toy, you do not give them the toy. If they're having a tantrum because they don't want to brush their teeth, well, you still make them brush their teeth. So don't give in to their demands. You want to maintain the demand that you've given. So if you've told them to do something, you want to maintain that demand. And you don't want to give in to their requests or their cries or their pleas to have more time to access a preferred snack or whatever it is that they're asking for inappropriately. Okay, so you also want to avoid providing unnecessary attention. So you want to avoid unnecessary explanations or requests. You just want to restate exactly what it is that they need to be doing. And you want to maintain safety. So if the child is engaging in dangerous behaviors, you want to maintain safety. So that means, whatever it is that you need to do to make sure that they're safe and that other individuals in the area are safe and the items around them are not dangerous. Okay, so step one is crisis management. Don't give in to demands. Don't provide unnecessary attention, and maintain safety. After that, and somewhat during that, you want to be assessing what the function of the behavior is. What is it that they're working on? Typically, whenever we have a tantrum, what's happening? What makes this happen? What makes it stop? When is it happening? Why is it happening? So you want to assess the function. Are they trying to escape a task demand? Are they trying to gain my attention, or do they want attention, positive or negative? Or are they trying to access some kind of tangible activity or tangible item? So if you haven't been following us, go back and watch the YouTube series and follow us on our website and look at the materials for functions of behavior and functional behavior assessment. That'll give you some more information on how to assess and look at that function. Once you have a pretty good idea of what the function is, then you're going to develop an antecedent or a preventative intervention. Because the last thing you want to be doing is waiting for a tantrum every day and waiting to respond. And the last thing that you want to be doing is always yelling, always grounding, always giving consequences. We want to have these positive relationships with our children. And so that's what antecedent and proactive and preventative strategies are all about. So you want to go back and watch this series. It was done in, I think, June and July of 2021. Go back and watch those series on everyday behavior strategies for parents, everyday behavior strategies for teachers, and special considerations and reinforcement that we talked about last month. So go back and look at those antecedent-based interventions, watch some of those videos, and look at how can I prevent this from occurring in the future, because it's not about what we do immediately after. 90% of behavior intervention is what we're doing beforehand to prevent the behavior from ever occurring. And so how can you have those preventative and proactive strategies? Part of that is also identifying a replacement behavior. So do you want them to ask nicely for something? Do you want them to engage in our behavior, such as getting ready, taking a shower, taking a bath? What is it that you want them to do instead? So what is that replacement behavior? And so I encourage you to watch the YouTube series on skill-based intervention, which looks at how do we identify, teach, and reinforce an appropriate or an alternative behavior. The last thing that you need to do is be consistent. A lot of times we give up before we have time to see the results. similar to dieting, behavior intervention is you've got to persist. So you've got to develop your intervention, make your plan, and then you've got to follow through consistently on that plan. And if you're consistently following through on that plan and you set up a good plan, a good behavior intervention plan, then you're going to notice those results. But sometimes it takes a little bit of time to see that change. So I always joke that when I got my PhD, I didn't get my magic wand or my fairy dust. They failed to give that to me when I walked across the stage. So I had to do things the hard way. And so there isn't this fairy dust or this wand or something that's going to make a child not engage in tantrums. It's a lot of little things that you're doing along the way. So please go back and watch some of those videos and series and see if you can't come up with some additional strategies and techniques to prevent before it happens and teach some of those replacement behaviors. Thank you for watching, and I look forward to presenting you some additional ideas later on this month. Please follow us on Facebook or on YouTube at Everyday Behaviors with Dr. Mary Ann, or follow us on our website at www.everydaybehaviors.com.